our ability to recognise mental illness, and more importantly, our population's ability to recognise mental illness in themselves and each other, is absolutely saving lives.
How depressed do you get at times?
I think at the bottom of the pit at times.
We do a regular mental health check on everybody with mental health issues. The old days where we used to say to people, get on with life and pull yourself together, I think are far gone. You're not seeing any horror films anymore, are you?
I've cut down on them now.
Good. I think you've got enough problems looking after yourself without them compounding things. You went through a really bad time at that stage.
1 in 5 mothers will suffer with some sort of mental health problem, whether that be depression or even psychosis, during their pregnancy or even up to a year after their pregnancy.
What sort of thoughts are these?
Like, I wish I wasn't pregnant.
The life she's living at the moment is bad for her in all sorts of ways. She's so isolated, it's not good.
Hello, Final Surgery. Nikki speaking. How can I help?
Myrsini, James, please. Hello. Hi. I'm Dr. Tailor. Nice to meet you both. How can I help?
I'm 21 weeks pregnant, and I saw my midwife on Tuesday.
Uh-huh.
And I was talking to her about how I'm feeling lately. So I'm feeling a bit down. I'm on antidepressants.
Right, okay.
So I'm on fluoxetine at the moment, 20 milligrams.
Okay.
So she's suggested that I come on meds.
Okay.
Or that I go on to a safer, low-risk one. I'm just finding I'm not coping.
Yeah.
I'm slipping into a depression. I don't think my mind's in a healthy place, so...
Yeah. Okay, so obviously you've been going through a lot recently. It sounds like it's been a fairly involved pregnancy with all of this going on. And when you had your daughter, did you have any mental health troubles after she was delivered, in the immediate period after delivery?
I was fine the first 3 months, but I found after 6 months, that's when I actually... I slipped quite really badly.
Right. When I saw Mrs. James, she was 21 weeks pregnant. She had been diagnosed with depression prior to pregnancy and was already on medication when I saw her. There's understandably a lot of concern from expectant mothers as to whether they should be continuing with their antidepressants during pregnancy. We absolutely try and discourage patients from suddenly stopping medications during pregnancy because we know that can be related to sort of worse outcomes in the long term.
Have things gotten to the point where you've had harmful thoughts?
I'd say yes.
And can you tell me a bit more about these thoughts?
It's difficult to say out loud. So.
Okay, would you rather it be us in the room?
No, it's not that.
And any thoughts about harming others? Have you had any thoughts about that? No. Okay.
No one, no.
Here we go. Christian, take a seat, Christian. No, not that. Mine, mate. Right. How are you doing?
Good, thanks, yeah.
Yeah? We need to take your blood pressure, apparently.
Okay.
Because I haven't done that for a while.
Yeah.
Let's do that. So if you pop your coat off. Have you got any complaints or worries or anything, or is life really good?
Yeah, I was going to ask about the medication, I don't know if you've got to change it or not. Now the results from the hospital.
Let's have a look. Yeah. I think the person that would change it would be your psychiatrist.
Okay. I haven't seen them for a while.
Yeah, you need to see them. So Christian, I've known for many years, and he has been suffering from a type of psychosis with features of paranoia. If you look at mental health issues, you can divide them into psychosis or neurosis. Psychosis being things like schizophrenia, where the person involved doesn't realise that they have their own mental health issues. A neurosis, like depression or anxiety, generally occurs to somebody and they realise they have their own mental health issues rather than the rest of the population. Are you still going to the gym?
I haven't been for a while, I need to start getting back.
Yeah.
Yeah.
What are you doing with your days now?
Being lazy.
Being lazy. Okay. Run me through a typical day for you, Christian.
During the week, I go to see my mum and help her out.
Yeah.
Or I just sit down and play computer.
Okay. What are you doing on the computer?
Play games.
Play games. Yeah. What's your favourite game?
Mortal Kombat, FIFA.
Yeah.
Like those kind of games, yeah. Or sometimes go to cinema, maybe.
Yeah, okay.
Go to
Yeah.
cinema.
You're not seeing any horror films anymore, are you?
I don't really. I've cut down on them now.
Good.
Quite a lot. Yeah. They're no good, are they, really?
They're not good for you.
Yeah.
I think you've got enough problems looking after yourself without them compounding things. You went through a really bad time at that stage.
Yeah.
So you're still living in your own place, though?
In Langley, yeah.
Yeah. Yeah. What about alcohol? Do you drink much or not?
I've cut down a holiday drink now.
Yeah. So what? Every day?
Even fizzy drink, I've cut down.
Really? Good.
Too much sugar in that, isn't it? Make you get fat.
It does, particularly if you're not going to the gym.
Yeah.
Yeah. Okay. So I think just to clarify things, so stay on the medication. We're not going to change it, okay? But we will need to do regular blood tests.
Every 3 months.
Will you be able to come back every 3 months to have that done?
That's fine,
Yeah? Christian is on a medication called olanzapine, and he has been on it since as long as I've known him. We do a regular mental health check on everybody with mental health issues, including all blood tests as well. Some of the antipsychotics, for instance, may have a tendency to cause diabetes, for instance. So we'll be doing a regular yearly check to make sure that that hasn't occurred. So we'll do that, and I'll keep an eye on those tests just to make sure that there's no... And if there's any problem, if I think things are worsening, then I'll call you back in, OK? Stay on the medication as it is, OK? The things you've got to do now are join the gym, really important, because I think that helps everybody. OK? Yeah. Exercise is really good. And also it stimulates you a little bit. You don't want to be stuck in the house all day. So stay on that. Blood test for you to organise, OK? Gym for you to organise.
OK. Get straight on it.
Good on you. OK, mate.
Take care.
OK, you take care.
You too. Good to see you.
Good to see you as well. And if you're worried that anything's worsening in any way, then give us a call and come back in, yeah?
OK. Thank you.
Good on you. See you, Christian.
Okay. Thank you.
See you, mate. Bye-bye. Is that the new uniforms?
We're wearing the t-shirts. Us newbies had first the shirts, but now that we all got t-shirts. It's because it's too hot, the shirt.
It's a nice colour.
Do you think?
Goes well with the pink.
It gets dirty really quick, though.
Yeah, same as these ones. Tell me how bad these are, these shirts, these NHS shirts.
Yeah.
Well, you know that rain we had on yesterday?
Would you want me to write it on here?
I created 3 wet t-shirt competitions and won every single one.
Oh, no.
It was actually all a see-through. Only thing was hiding everything was that.
That's too funny, actually.
The thoughts that come into our mind, I know that they're not healthy, but I also know that they're not...
Okay.
They're not ones that I would do.
What sort of thoughts are these?
Like, I wish I wasn't pregnant.
Okay.
You know?
Yeah.
Maybe things would be better.
Yeah.
Give that a week, my darling, okay? Give that a push. Any concerns, we'll write to you. Lovely, well done.
You mind if I use my phone?
Stop ringing now.
All right, so I'll leave that prescription at reception for you. Okay, bye-bye.
Who's that?
Oh, for the kids.
The grandchildren, yeah?
That's the 3.5-year-old, that's the 1.5-year-old, yeah.
Oh, there you go.
Oh, hello? Come and have a seat.
Chris, I'm sorry.
You're in demand.
It's my family day. Hello?
What sort of thoughts are these?
Like, I wish I wasn't pregnant. It's causing a lot of problems, so... And with us, and so that's why I just feel if I can try and...
Yeah.
get better mentally.
Yeah, of course. Well, look, you've done the right thing by coming in. I always say to my patients that medications are only part of the solution here, and that really the actual cure is the support and the psychological therapies that we can often direct them towards. Mrs. James had expressed some worrying thoughts, and this did make me also quite concerned and want to get slightly more urgent help for her. So I think what I would like to do is get sort of more specialist advice before we potentially change anything. I think ultimately what we probably need to do is get you in touch with one of the community mental health team who can kind of guide you throughout the rest of the pregnancy. I think also we need to think about the period immediately after you deliver, making sure that there's enough support for you there, because that'll be a critical time as well, because obviously with twins it's going to be challenging. There is a special team that look after women who have mental health problems in pregnancy and then also in that immediate period after pregnancy as well. And I wonder whether you would benefit from them as well.
That's Crystal too.
Yeah.
We're already part of it.
So you already are part of them? Okay, brilliant.
Crystal,
Okay.
yeah,
We've got drug and alcohol history, so it's...
Okay. And just to ask, with the drug and alcohol, is that something that's an ongoing issue during pregnancy, or is that something that...
Oh, no, I'm clean now.
Okay.
4 years in December.
Okay.
So, yeah.
All right. Okay. There's a lot of evidence linking drug and alcohol addiction with mental health problems. In the case of Mrs. James, in fairness, she had been clean for 4 years, and I'm not sure in her particular case there was a direct relationship between her past history and her current presentation with her anxieties. But it is always something that we bear in mind when we're targeting the type of support that they need. So I'll contact you before the weekend.
Okay.
It may be that one of the mental health team, I can give them your details if you're happy with that, and they can contact you.
Okay.
Is that all right? Yeah?
Okay.
Perfect.
Thank you.
Okay.
Thank you.
Take care. Bye-bye.
Most people are trying to escape the heat.
Thank you.
Are you okay walking up the stairs?
I need the exercise.
Good. Well, don't we all?
Really like that smell. Fresh linen, isn't it?
My house is full of air fresheners.
Is it? Yeah, I do like that one.
There's one in the hallway when you walk in. There's one at the top of the stairs. There's one in the bedroom. There's one in the spare room. There's one in the bathroom. There's one in the living room. There's one in the kitchen.
Okay.
Right. How can I help?
Well, you gave me antidepressant pills,
Yeah?
but they don't work.
Oh, really? And is your mood not good?
No, it's not good. It's getting worse.
Really? And in terms of feeling down, feeling depressed?
I feel down, yeah, all the time.
Really? Yeah.
All the time.
Would you like some talking treatment?
No.
No? You don't want...
I sit in my house alone all day for the most part, and I go to bed at night. The same situation.
Do you feel lonely?
Yes.
You do, yeah. How depressed do you get at times?
I think at the bottom of the pit at times.
Just sit forward for me, Paul. Just take your temperature. How fed up would you feel?
Well, I don't see any future,
Yeah,
if you know what I mean.
I do. Yeah. It's normal. So what do you do all day? How do you fill your time?
Doing nothing, usually.
We know that people who are lonely tend to become depressed, and the ordinary difficulties of life that we all experience become more of a burden for them. So we would call that a neurotic development.
I just wish I had an answer to it all, but I don't.
Well, I think there are people that we could get to help you to come in and visit you if you'd want, that would break the monotony. And there's a Slough Seniors group, which is very good. Age Concern will do it. And even the Fire Brigade have a loneliness service that is really very good.
Yes.
Yes. I'd like to see you with a fireman or two around. I'm sure that would cheer you up. But it's a very good service. I think that companionship is really important.
Yes.
We all need it. And then once you get a bit of it, it brings you out of yourself.
Yes.
And so that, I think, is the way ahead. And I think I'll organise that and get people to visit you. So I'd like to change your antidepressant medication.
Do these pills raise the spirits, or...?
They do raise the spirits, and they raise the chemical in your brain, serotonin, that is responsible for the feel-good factor.
Good.
And sometimes in these situations, that's what runs low.
Yes.
Or it's consumed too fast by the nerve endings.
Yes.
So there's not enough of it there.
I see.
And what this does is it replaces that.
Yes.
And that's how it works. So you can give me a call anytime. Just let me know how you're doing. And I think those two things together will make a big difference. Good. Yeah.
Oh, dear.
Because we're growing older in ever-increasing numbers, then unless we get really good at tackling loneliness, we will be paying the price for not doing so in all kinds of ways in society. And that makes loneliness a key risk factor. And I think it's one that we would ignore at our peril. Good.
Thank you very much.
Not at all. Nice to see you. Yeah, you take care. Do you want me to walk with you?
No.
You sure?
No,
Yep.
yeah.
Mhm. Good.
Can we have a bit of that now? Yeah, that's fine. We don't do it when there's patients in because he may be suffering from asthma.
Amy Rosen. Good afternoon. Come and have a seat. Long time. No see?
Yeah, how long has it been?
It's been probably a year, I think.
I went out a few days ago with my friend and we were just going in a park, but I felt like I had to sit down. It was just too much for me to cope with. And I was like, why do I feel like this? I should be, have energy. I just didn't feel like that. I feel like nowadays I just feel like I always need to sit down.
Everything is a chore, tiredness, lethargy.
Yeah, and even like I'm a bit afraid in case I might faint or anything. Not all the time, just sometimes. I just don't know what that is about. Any idea? Or?
Tiredness can be due to 2 or 3 reasons in your situation. One of them is, of course, depression can make anybody tired. And the second thing is any other medical condition. Amy lives with her mother. She's got Asperger's syndrome. Asperger's is a mild form of autistic disorder characterized by awkwardness in terms of social interaction and difficulties in non-verbal communication. Because of that, she is socially withdrawn and hence associated depression. The third thing is any medical condition like diabetes or anemia, low hemoglobin, all these can cause that tiredness, lethargy.
I think it's a bit bad for both of us at the moment, Doctor, because, to be honest, Amy's... Yeah, it'd be great if any physical reason was discounted, but the point is, the life she's living at the moment is bad for her in all sorts of ways, and it's not changing at all. She's so isolated. Her day, she very, very rarely sees anybody. It's not good. The family dynamics of living with somebody who has Asperger's or depression can be very traumatic. They should receive help, support. They need to have their own sort of respite. Otherwise, we end up with a family full of depression. And that is not a good sign for the mental well-being of that child. Amy missed 3 days of Prozac, and I kind of felt that she got more aggressive and verbally and, to be honest, a bit other way. So please do make sure in the future not to miss, even if you miss not more than a day. Yeah. When did you last have any blood tests?
I think about 9 months, 6 months, 7 months ago. I'm really not sure. I'd be more than happy to have a blood test done. I just want to know because it's just really frustrating and worrying knowing what's going on. You just don't know. And
have you managed to have all these interventions and help and talking therapies and CBT and all that stuff?
I will be there next week.
That would be the right way forward. Okay?
Thank you very much.
All the best. Bye-bye. Take care.
Here, Mum. Here, Mum. Be nice, nice, nice. Oh, yeah. Whose bright idea was it to make self-check-ins for doctor surgeries? You need shooting. They never work.
Actually, my doctor's surgery where I go, it works.
Hey, well, no.
How can I help?
Okay, so we think that Damien might have ADHD. There's a lot of stuff going on with Damien, his behavioural problems. We spoke to him last week and he said that he's got little miniature voices in his head that tells him to do bad things, and when he's doing the bad things, he also gets another voice in his head that tells him to stop doing the bad things. His behavioural problems have been ongoing for quite a few years, but to be honest, I think it might be time for a referral with Damien, because I only know a certain amount. He has got a lot of anger issues.
And give me some examples of his behaviour.
Behavioural problems. He bullied a child in school for no reason whatsoever. When I asked him why he did it, he turned around and said, I don't know. And with his brother and sister, anyone touches his stuff, it's like World War III in his own little world. There's a lot of anger underlying in there.
ADHD sometimes gets used as a sort of catch-all for behavioural problems, which formally it isn't, because there are formal diagnostic criteria to be met. But it often presents with a behaviour problem.
You know, when he's first to play on his own, he's the class clown at school. There's just very many things that are kind of pushing me towards that. And
Do you think things are getting worse?
yes.
Just for you, I've come to a closer room.
Oh, thank you.
This keeps coming up on my mouth, and I don't know what it is. I've tried pseudo cream, I've also tried antiseptic cream, and also tried putting neat aftershave on it.
This one's still swollen quite a bit. I call them Gert and Daisy. Gert's fine.
It's all coming off nice and easy anyway. Let me just plan and brush out after this.
It's really painful around the elbow.
Right, well, I promise not to chop your elbow open today.
He will open up, but he's got scars on his forehead from
Since
where...
when I was born, I used to get so angry, I used to stomp up to my room and start scratching my face.
Yeah. Like, if he's ever angry, he can't sit still. He's constantly moving.
OK, what's the situation at home?
Situation is...
Dad around?
Dad's still around, yeah. We've split up.
And is it the same father for all three kids?
Yeah, Dad's still around.
Yeah, OK. And there's no problem there, there's no issues there between father and son or anything like that?
No, they get on really well. Dad picks them up from school, I drop them to school. They get all their bonding time.
Okay.
Perfect. It's just trying to figure out what it is and then deal with the situation.
Yep.
Because it can be quite difficult, because I also have a son who's autistic. So it can be...
Is that older or younger?
Younger. And they just clash all the time.
Yeah.
They're never
OK.
nice.
All right, we'll send you over to the other doctors, Damon, all right? And they can have a look at you and see whether you can work this anger thing out, yeah? There wasn't enough in the consultation to say he had ADHD, and I'm not so sure that he did have. But the story about how he was behaving at school, his lack of attention at times during the consultation, there was a possibility of it. But more broadly, I had a 10-year-old child in my consulting room who clearly had some behavioural problems, and so referral to the community team was justified on those grounds, irrespective of whether his diagnosis was ADHD or not.
It's all right, mate. He's going to try and help.
Let's see what they say. Management can be from talking through to drugs and anything in between.
Yeah.
Okay.
No, that's fine.
If it is that.
Yeah.
ADHD can be treated in terms of therapy, in terms of talking therapy if it's a behavioural problem, but also with medication. It's quite a difficult condition to treat and requires medication being taken sometimes for many years. OK. Is that all right? Yeah? I'll write to them. You should get a letter and a response.
Brilliant.
And take it from there. OK, Dave?
All right.
Take it easy.
Thank you very
Bye-bye.
much. Cheers.
Bye-bye.
Bye.
Thought I'd come downstairs today, obviously, just to help you out, you know. What's happened since last week on the all the rest
Well,
of
I
this
took
front?
those tablets you've been giving me, which is helping to knock me out, literally, yeah.
Do they knock you out?
Yeah, well, I still seem to be sleeping a lot better or a lot more. But
Okay.
I'm still having down days.
Yeah.
Still having nights where dreaming, yeah, and it just drags you down, yeah. We're not, I don't know what you call them, nightmares or whatever. I just don't know. I just don't know where I'm going or how to get around it at the moment. Everything at the moment in my life just seems to be a fight.
David is well known to myself after seeing him regularly over more than a decade now. He has a number of medical issues which have caused him great grief over that period of time. More recently, he has injured his hand following a fall brought about by an apparent altercation.
Maybe I have something similar to like ADHD or something, because all my life I've been like it, yeah. But in the 60s, he was just a bad boy, yeah, and he was sent off to naughty boy school, which was great because I enjoyed it down there to a certain degree.
Anger and aggression are both feelings that everybody has at various stages during their life. Until an emotion starts affecting your lifestyle or affecting other people around you, then it's probably a normal emotion. But once you cross that line and everybody else is being affected, or you're being affected, your health is being affected, then it becomes a problem.
Rugby was always been my release of energy, yeah. When I played rugby and in the army, yeah, me and a corporal had disagreements, right, when I first joined up, and we went off down a boxing ring, hit the shit out of each other for 3 minutes. And after that, it was as great as anything, yeah, you know what I mean?
You're not able to do that quite as often these days. In fact, that was part of my school rules when I was at school, was that if you had a disagreement with somebody, you could go, we had a school disciplinarian, and you could go to him and ask to box the other person, and he would provide the gloves and watch the match. But, and the big but is that to do it, you both had to have 6 cuts of the cane first each, because they didn't want everyone to do it.
I became in school, it never worried me. I came first day of secondary school, yeah. And the headmaster went to me, is this how we're going to go on? I went, maybe.
What about talking therapies?
Well, I went to them before, didn't I?
Yeah.
And we did 6 sessions, and they're telling me, oh, well, you know, you've got to try and keep you cool. Well, I don't know. We could try.
Let's try it again. Yeah. Okay, because I think, you know, and also when they do the assessment, you need to say, look, we tried something in the past. It didn't really work. You know, they've got so many different ways of doing things now that it might be worth them just trying a different track this time. Yeah?
It's worth a go, yeah. I'll give that number a ring and see where we go, yeah?
Good. Okay, mate.
All right, thanks a lot,
See you, mate. You take care.
No problem.
Bye-bye.
There's by any chance having square batteries there?
If you can't fix it, don't worry, you can pull it off the wall and chuck it out the window.
Hello, come and take a seat. What can I do for you?
My psychiatric nurse sent me what it was. I'm getting like 4 hours sleep a night, and I'm getting pains in my knees and my thighs and stiffness in my back as well.
Okay.
And could you write me a letter, just a quick letter, so I can post it with this? Just a few paragraphs to say like that I'm schizophrenic.
I'll just print out your medical records. You can send those with you. You smoke, Mr. Richardson?
Do I smoke?
Yeah. Okay. Can we check your blood pressure while you're here? Okay, just relax. Are you drinking much alcohol at the moment?
No, not really. 2 cans a day.
Cans of what?
Stella.
Schizophrenia is a long-term psychiatric condition that's characterised by several sets of symptoms, one of those being hallucinations, which is where the patient sees or hears things that don't actually exist. The other one is delusions, which is that they believe in something that you can't give an explanation for. And those 2 problems in turn can then lead to sort of muddled thinking, which is often how they present. So you're on vitamins and you're having the injection, is that right?
Yeah.
Okay.
That's what I think I'm getting side effects of.
Yeah, the haloperidol.
My jaw goes and everything, and I can't get it to realign in it.
Right. When are you due to see the consultant again?
I'll see her on Thursday.
I think what you're describing is some of the side effects of the haloperidol, so you need to tell her about that.
I've already told her.
You already told her. But I think what we'll do today is to just run some blood tests and check we're not missing anything. Is that okay? Yeah. Approximately 1 in 100 patients will experience schizophrenia in their lifetime. Some of them as a one-off episode, some continuing on to be a more long-term problem. So that's your vitamins, okay? That you need to put in that envelope and send with you. And if you take a seat back out in reception, the nurse will call you for some blood tests.
Right,
okay.
Thank you.
There might be a little wait, but we need to get them done.
Okay.
All right.
Yeah.
Bye, Mr. Richardson.
How are things?
Oh my God, my foot. I felt someone like bite my leg.
Yeah.
And then all of a sudden it's ballooned up.
Had 2 bites.
So how long has it been red like this for?
Probably 4 or 5, 6 days.
Is it getting worse?
Seems to be getting bigger.
And it just turned out like this.
It looks like it might be infected.
Your legs are a bit swollen, aren't they?
It looks like it's got a bit infected, doesn't it? So I think
Yeah.
it needs some antibiotics by mouth.
Been bitten there as well. And I've never had problems before.
Someone likes you. You don't normally suffer with bites.
No, never.
So we need to be keeping your leg up like that as much as possible, okay?
That's no good to me.
Yeah,
I need
I know.
to because
I
of
know.
work.
Just wished I'd came earlier.
Good at Verdi.
Hello, doctor, how are you?
Hello, I've got a student with me, is that okay?
That's all right.
Great.
I don't mind.
Good. Have a seat, thanks for waiting.
The problem is my medication, and I need it because of my last card.
What, the pharmacy said they haven't got it?
Yeah. They have to order it, and it's going to take time.
Okay, so how can I help?
I just wonder if other tablets can I take?
So, this is a brand of lithium. So the only thing we can do is give you a different brand. But the problem is, these different brands have different strengths and may not work in the same way. That's the difficulty. Gerdip has a condition called bipolar affective disorder. We used to call this manic depressive disorder. And this is a condition where the mood can swing between being quite low and then sometimes being quite high. Bipolar affective disorder is not normally cured. We normally treat and manage it. We use lithium because it's a mood stabilising drug. Let me just have a chat to them. Stay here, okay?
All right. How are you finding it? Yeah, doctor's not very easy, I tell you. Our doctors say like a lawyer. My dad said, be a lawyer. And I said, no, I don't want to be on a businessman.
No, just looking. Just iron up your hobnobs and a rich tea biscuit. Oh, I haven't had
Rich tea, without tea,
soggy.
yeah, without tea they're boring.
Tea,
Boiling
hot cup of tea. 2 sugars.
But if you leave it in too long, does it really wind you up when you drop it in?
Yeah, because then I have to scoop it out. Yeah.
Yeah, I hate that.
OK, how are you?
Right, the thing is, I'm really, really depressed.
Okay.
And I don't know if it's my health or what,
Okay.
what it is.
OK. What do you mean depressed? Like, what do you mean? How do you feel?
Like, every day I don't want to get up.
Yeah.
Things like that, you know.
Yeah.
I know something's wrong with me, but I
Yeah.
don't know what.
How long have you been feeling like that for?
For a long time. About 3 or 4 weeks, and I don't know what to do. You know, I was, narrowing down where it's coming from.
Yeah.
It's nothing to do with the house. It's nothing
Okay.
to do with my family, my
Okay.
husband, nothing.
So home life is good in that sense?
Yes, it's brilliant. And there's a wedding coming on and everything, and I just wanted to see if this could be.
Health related?
Yeah.
Was there something specific that you're worried about? Any particular problems or any other physical symptoms or anything like
Yeah, because sometimes I get a headache or I feel dizzy.
Okay.
And that's what made me think it must be
When do you get the headaches and dizziness?
when I get really stressed. And when I get stressed, my head feels like it's going to break.
Yeah?
That's how the stress I get.
So does that tend to happen more when you're at work, or is it like in the evenings when you're at home just before bed, or how does that work?
I think it's generally at work. So thinking maybe could it be me physically ill?
Yeah. So we can definitely have a look at that.
Yeah.
I just want to ask you a few quick questions. Though.
Okay.
Do you ever have thoughts of sort of hurting yourself, or thoughts of being better off dead, or anything like that?
No, sometimes I do that.
Yeah.
But I wouldn't do it.
What kind of thoughts?
I know I'm not going to do it.
Yeah.
I'm a coward.
Yeah.
But, you know, I feel maybe everybody's better off if I'm not here.
So today, I'm going to do your blood test.
All right. I brought this early morning thing.
Thank you. You're the only person that's bought one today.
For somebody who's 87 knocking on the door of 90, I would be absolutely loving it if my blood tests were like this.
Oh.
I appreciate what everybody do for me.
You're welcome.
Especially you.
Can I check your blood pressure? Perfect, as always.
Oh, good.
And now, it's the first time ever I won't have to pay for my prescription.
You don't have to.
I'm 60. It's still the cheapest place in the world. We are very lucky.
Okay, I've got 2 options.
Right.
Okay, they've got 15 capsules there. Option 1 is to take what they've got, and then we'll see what happens.
That's what I'm thinking of.
Okay. Option 2 is to try a different brand, but we'll be guessing the dose.
If I say option 1, be better.
Okay, so take what they've got. The problem with lithium is it's one of those few medications where you need to have the same tablet from the same manufacturer because the body will absorb and treat different manufacturers' versions of lithium in a different way. If you don't have enough, it doesn't work, but if you have too much, you start to get really unpleasant side effects. And if you take too many tablets for too long, this can be ultimately fatal. And so we have this now what we call a therapeutic window where we give medication and then we do blood tests to make sure that the dose that the patient's got in their bloodstream is between the top and the bottom level, so they're having the right dose to give them the effect. This happens sometimes with manufacturing medicines, so I'm really sorry this has happened.
All right.
So go to the pharmacy.
I'll go now.
Go now. Give them what they've got, okay, and hopefully they'll be in next week, but if not, come back and see us like you have done and we'll give you the other stuff. Thank you. Good luck. Take care.
Thank you.
Bye-bye.
Bye.
Have you ever tried doing anything like to hurt yourself?
No, never.
No.
I never go that way.
And family-wise, you got kids at home, or?
Yeah, kids, everything's brilliant. We all live together.
So do you find that stressful, or do you?
No.
No, enjoying it?
Yeah.
Okay. So it sounds like it is more to do with the stress and the psychological kind of element, you know? It sounds like maybe the depression side of things might be true. But I don't mind looking at sort of whether there are other physical things, so we can do things like blood tests and we can check that there's not something like thyroid or diabetes or anemia, that kind of stuff.
Maybe it could be physical that I'm feeling like this.
So why don't we do this? Why don't we start with doing some blood tests?
Okay.
I'll book you a follow-up with one of us, okay, to kind of talk through the blood test and then maybe talk more about dealing with how you're feeling rather than physical stuff, as long as that all looks okay.
Now, do I need to have a rest from work, do you think?
Yeah, possibly. So if work is the main stressor, then I don't mind, yeah. How long do you think you need off?
Maybe just 2 weeks, just to get...
Yeah, sure. Just to get your head straight. Do you think you need something like counselling?
I don't think it's anything like that. Just I think it's just pressure, you know. It's getting to me too much.
Okay. I'll do the note for work.
Okay.
I'll give you an appointment to come back and see one of us.
Okay, thank you very much.
No problem. Take care. All right.
Okay, thank you so much.
No problem. See ya.
Okay, bye.
Bye.
And the first letter of your surname. Yeah? Who did it say you're seeing?
That's brilliant.
Hey, amazing, see?
You're going to be out for job shortly.
Oh, trust me. The amount that we have to do, it's easy to just check yourself in and go straight through.
But see, you're in a good spot there. You can see what the things are up on the wall, can't you?
Did it say who you're seeing?
Thank you.
No worries, too excited. How are you?
I'm actually feeling a little bit better than I was a couple of weeks ago. I actually did take the tablets, but the problem is that they were making me feel like I was losing days. I couldn't remember anything. They were just a bit too, well, really strong, weren't they? They make you feel a little bit worse in the morning.
So, was that? Are you still taking them, or have you stopped?
I stopped taking them because I couldn't handle them. And I was getting a little bit spaced out. I was like,
Right.
I didn't want to.
So you took them for a few days and thought you're just not feeling well with them?
This one, they weren't agreeing with me, but I am doing a lot more now.
So what have you done? What have you changed?
Well, I've got the haircut.
Yeah, that's good.
I just like, I'm helping my auntie a lot more because she's been ill, and so I've been helping her with the garden and stuff like that.
Yeah.
And trying to get like back up to looking for work and stuff and doing that now. So
that's really positive, especially because you've done it without medication and you haven't.
I just thought after last time I was like, having a little bit of a word with myself, thinking, I need to just snap out of there.
Are you having any of those negative thoughts about yourself?
No, I'm having bad days, but I'm not having the thoughts that I was having before.
Yeah. What about those episodes where you're feeling like very aggressive and angry? Are you getting any of those?
I still have a few little issues with that. Like I'm a little bit short-tempered a little bit.
Right.
And there's been some days where I haven't been arguing, and then some days I'm like, oh, for goodness sake, shut up, But.
And are you having any counselling at all?
No. I've been speaking a lot to my auntie. She's been helping me a few things and that, and then my family members have been helping me a little bit more with the talking situation. But no, I haven't really seen anybody else about it.
Did I talk to you about the counselling?
Yeah, you did.
So you've got the number.
I've still got the number, just in case. I'm still keeping it with my phone, and that's just in case.
Fine. Okay. Well, you seem to be much more positive, so that's good.
Yeah.
And you are doing it without the counselling or medication, so that again is
I feel a bit better than myself now. So.
Good. Well, that's all positive and reassuring.
Yeah.
If you notice things change, though, just either give me a ring or pop back in to see me.
Yeah, that's what I was going to suggest. Instead, coming up here and
I'll see you in a few weeks.
Okay, thank you very much anyway for seeing me.
Take care, that's all right. Pleasure. Take care then. Bye-bye. I'll see you in a month.
Thank you so much.
You take care.
All right.
Bye-bye.
See you later. Bye-bye.
Excellent.
Thank you very much.
No trouble. Lovely to see you. Bye-bye.
Surgery, how can I help?
There's well-documented evidence about what safe levels of drinking are.
I know my body. Your opinion is totally different from my experience.
Sure.
I'm going to tap on the legs, and I want you to say yes when you feel me tap, OK?
Sorry.
How much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out.
You're feeling any easier?
Yeah, I feel a lot easier.
Curious, aren't you?
Barnaway Surgery, Cindy speaking. How can I help? Oh, I've got an appointment booked for my son, Louis Hugh.
What's up, Annie baby? You didn't bring in any chocolates?
Hello, Evelyn.
Oh,
You've been good?
Well, don't know about that.
Try to talk him out of it. Yeah? Have a seat there.
She's not been too bad.
Oh, OK. You've been good?
Yeah, no more practising for the Olympics.
91.
Yeah, 91, runs rings round me. She's got more marbles than I have.
And though it looks red, it's not painful. Don't want to leave the remaining skin.
Trouble is your skin's so thin,
Yeah, I
it
know.
tears,
I do
so it's like... You'd make a great tissue.
Thank you. Oh, dear.
Oh, that's lovely. Take that off. It's great.
Does it feel itchy?
At the top part.
Does it look better?
Let's have a look. It looks like the fluid is gathering at the bottom there. By the time you finish your antibiotics, yeah?
But can you imagine when she rang me and said, I've scratched my leg?
Oh, dear. Yeah, yeah.
It's not what I class that. Look.
You wouldn't classify that as a scratch. That's a scratch.
And tell her why you've got
And yeah, these are scratches from doing her garden.
Oh, did you?
It's lovely because that's the first time I've had to ask any of you to do things like that.
Yeah?
Yeah.
We intend to do things like that, but by the time we get round, you've already had done it.
Yeah.
Oh, she's already done it.
Oh, she's worse than a child.
Oh, it's good to be independent, but
there's just really unnecessary.
you still got to look after yourself. All done?
Yeah, I'll have to get the girls to cut my toenails.
That's down to them. I don't do feet.
No, but they do that, don't they?
Yeah, they can do that. I don't.
All right.
That's my granddaughter.
Oh, she's gonna do that.
They're beauty therapists, so they're used to feet.
Oh.
That's why I'm so used.
Yeah, there you go, Thelma.
Well, you're such a stunner.
All done?
Yeah, you're lovely.
Yeah, and...
Oh, how lovely. She's my friend.
Well, I'm going to leave you here then if you carry on like that.
Mind that chair, mind that chair.
I know.
Yeah, all right. OK, we'll see you on Tuesday.
Yeah, definitely.
All right?
Thanks,
Okay.
hon. You have
All
a
right
lovely
then.
weekend.
OK, you too. Bye-bye. Bye-bye. Bye. Bye.
I send apologies to you.
You apologise?
You were the first person that I blamed for that. You were. Then it was Riff. Then I found out it was Little Miss Butter wouldn't melt in her mouth.
I wouldn't do anything so infantile.
I thought it was very clever that she thinks my bits and boobs look like that.
I put the red dot in the middle afterwards.
You think the other one's inverted?
Yes. Got an inverted nipple and you see a doctor.
There we go. I'm Dr. Tawana. Nice to see you.
Nice to meet you.
How are you?
Okay, thank you. It's, unfortunately, it's Louis who seems a little unwell.
Okay.
Yeah, he's just got a temperature today.
Yeah.
37.9.
Okay.
Last time I...
Last time you checked,
Yeah.
okay. We say up to 37.5 is normal.
Right.
Okay, so going up to 37.9, it could simply be that he is warmer.
Right.
And that his body just hasn't been quick to regulate his body temperature. How long has he had that kind of gentle kind of rise in his temperature?
That was this morning.
Just this morning?
Yeah.
Okay.
Also, his nappies are smelling a little bit stronger than
Yeah,
usual, but
yeah.
only by a tad.
Okay, so and that's urine rather than the poos, would you say?
Poo seems sort of normal.
Is he peeing normally?
Yeah.
Yeah, that side of things is fine. Good. Hi, young man.
Hello.
Hello.
Can you say hello to the doctor?
Has there been anything coming out of his ears at all?
No.
Good. Temperature 37.7, so it's kind of just slightly above the kind of threshold. If you hold him looking towards you, I'm just going to have a quick check in and around his neck. Talk to Mummy.
Hey.
Say hi.
You're not going to say hello to me? Louis.
Okay, so no glands that I can feel. And actually, while you're holding him like that, I'll have a listen to the back of his lungs. That's it. That's lovely. Perfect. Okay. If we swivel him round just a little bit, actually, if you wanted, you can lie him down across your laps. I'm just going to press on his tummy. That's perfect, just as you are. Hi, young man.
Hi.
Lips are moist, which is very good. Hi. He's got a lovely, lovely colour about him. He's not struggling to breathe, which is brilliant.
You enjoying that little massage there?
Yes. Don't normally get this on the NHS.
No.
That's a lovely smile there, young man. We're going to shine a light just in his throat, just to see how that looks. Here we go.
Good boy, aren't you?
Very quickly. It does make them gag a little bit.
Aww.
All done. Perfect.
Okay, good
So,
boy.
no sign of any obvious infections there. He's well hydrated, lovely colour, breathing beautifully. No sign of any infection anywhere. You look very well, young man. So no concerns from my point of view.
All right. Are you happy?
He certainly is. He looks it.
Thank you so much.
You're most welcome.
Right, say bye to the doctor now.
You're going to wave. We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic. Take care.
Okay.
All the best. Bye.
Bye now.
Hello.
My partner comes in with me.
That's all right, as long as you're happy.
Yes.
Yeah? Yeah, have a sit.
Thank you.
My name is Dr. Bajwala. And how can I help you, Gary?
I suffer with alcoholism and I've been drinking and drinking for 30 odd years and it's made me ill. I've been in hospital. But the last year or so it's cost me my marriage and I'm getting iller and iller. And I really now know I need help and I want to get better. I know you haven't got a miracle pill or injection, but please, I need...
Okay, so it's a little bit inflamed in that area. So we'll have one more go.
You're the boss.
You need to come to my house and tell them that.
I'm all for keeping yourself alive.
Yeah. Have to be honest with things, don't you?
I want to live longer.
Yeah, okay.
I'm ever so glad I come now.
Yes, you've done absolutely the right thing.
Thank you so much for putting up with me. I do appreciate everything you've done.
Just say thank you.
Oh, Dwayne, thank you so much.
No worries. Thank you very much for doing that.
No
I
problem.
appreciate what you've done so far as well.
Oh, no problem. That's really nice of you. Absolutely not necessary. It's part of my job.
So I understand your main issue is alcohol problem, and obviously it's affecting your life now.
Yes.
And you want to be
Stop.
cleaner.
Yes.
So how much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out. Wake up, drink again, till I pass out. Sometimes I don't eat for
What do you
3 or 4
drink?
days. Anything. But this morning, last night, I promised my
Tailor,
grandson I'd never
how many
drink
cans does he normally have?
Between 8 and 16 a day.
8 and 16 a day.
Yeah.
Anything else does he drink?
No, not really.
No?
This morning I got up and drank her vodka. I found vodka. And that's
Yeah.
what I've done.
Have you seen any alcohol treatment before?
Yes, years ago, but I keep thinking I
Many
can get
years
myself
ago.
better.
Many years ago.
All right, okay. Yeah. Are you eating all right?
No, I don't hardly eat at all, don't I?
All
I
right.
could go 4 or 5 days with no food. I don't care if you put me to sleep.
Can I have a look at your hands?
Oh, that's my
Yeah, we'll show the doctor your hand. That's what you told me the other day.
Oh, just
Wow.
see, I punch things. I get so angry.
You're going to make a fist?
It's all right. It's a little bit sore, honestly. But it's not about that. It's
Can I have a
about-
look?
It's
look
in there.
Okay, that's all right. Okay.
But this is the first time I really know I need help. I can't do it on my own.
I need to give you the phone numbers and address where you can see this alcohol nurse. You see them, they assess you, they will ask for the blood test, and they give you community detox. Yeah?
Yeah, I'll try anything.
Because what we have done studies in the past where I can give you tablets, but without support it never works. Yeah? I don't want you to stop drinking all of a sudden, because then you will start having withdrawals and you could end up having fits, which is not right. Okay? Regarding this punching, I think it'd be better to
just stop.
get have an X-ray.
That's okay. It's just a little thing.
If you want to have an X-ray, I can book
That's
it.
fine, honestly. It's not, that's
If you
not
change your
right.
mind, let us know. Yeah, okay?
Thank you very much. And you can't just stop drinking, can you? You're going to get help.
So, Gary, this works as a self-referral. So, if you're committed, you need to ring them and make an appointment. Yeah?
Yeah, it's a long time.
Okay. That's a blood form, which is very important. So, once the bloods are done, make an appointment after 4 or 5 days to see the doctor to discuss the blood results. And once they assess you and bloods are done, and if you agree with it, then they will give you community detox so that you can stop drinking. And then after that, they give you support so that you don't start drinking again. You can also go to Alcohol Anonymous as well once you're clean, so that helps you. Or you can start now if you're really keen on it. Okay. All right.
Thank you very much, Doctor.
Okay.
Thank you for your time.
All right, but don't stop drinking all of a sudden. Yeah? Okay?
Thank you.
Okay.
Thank you.
Yeah, bye.
When I was a kid, I got some glass in my foot and it'd gone septic. So they took me to Children's Hospital in Sheffield, and literally all they did was local, cut it out, but there was a big mirror there. They're going, you can look if you want, and I'm going, no, thank you.
I would have. I'm into all that gory stuff.
What we're going to do is an ellipse excision of epidermal cyst, because that's what I think it is.
Yeah.
On scalp. Okay, so reasonably low risk procedure, but there are potential risks because it involves cutting skin. So I just need to let you know about that. So infection is one of them.
Yeah.
Bleeding.
Yeah.
If we get the cyst out whole, then the chances of it coming back are much less. Not impossible.
Yeah,
Still a little cavity on it.
Yeah.
If we break the cyst, then it's much harder to get the whole sac out. And so actually that increases the chance, and we don't know until we do it, because it depends on whether I nick it with the scalpel.
Yeah.
So if you can sign away, unless you want to ask me anything.
No, that's fine. You explained it properly to me. Did you go anywhere or just took time off?
No, so it was a fasting month. So I was just taking time off to basically survive the last 2 weeks, really.
Oh, okay.
So
do you feel grumpy and no food or?
No, actually, it's more the fatigue. It's more fatigue. Eating and drinking is not a problem. You get kind of sort of accustomed to it, yeah, absolutely. But yeah, I'm back to the land of the living, which is good news for you for today.
What happened to your bits and boobs straw? Alison got rid of it when she came back because she didn't like it. And now there's bits and boobs everywhere.
This is my girlfriend.
Nice to meet you both. How can I help?
Benzoyl peroxide.
Okay.
I was wondering if I can get some sort of benzoyl peroxide.
Yeah.
On my face.
Yeah, to get some more, yeah. Okay.
Duo or something. We was talking about Roaccutane.
Yeah.
I think that was something.
Yeah.
Roaccutane, but he was on about saying I need to get referred to the hospital or something for that.
Roaccutane is actually a brand name for the drug isotretinoin, and we use this medication in cases of moderate to severe acne, but more importantly in patients who we think are at risk perhaps of developing scarring as a result of their acne. So your acne, is it mainly just in your face, or does it affect your back and chest?
I don't know.
It's mostly the shoulders.
Yeah, my shoulders.
Shoulders and then face.
Yeah.
Okay. So, how long have you been having treatment for your acne for?
I mean, I've had it for about 5 years now.
5 years,
I only
okay.
started getting treatment about 2 years ago.
Okay. So, what we do next really depends on you. We can keep going with the cream and the tablets if you think that it's making visible differences for you.
I mean, at the moment, I'm using tea tree oil.
Okay.
Just like putting a bit of that on my face just before I go to bed. It burns and stuff like that. But like, I get up in the morning, I have felt a significant difference between
that's
smoothness
fine.
and stuff like that.
I would say, looking at your skin, I'd classify this as moderate to perhaps quite severe acne in the way that it's presented on the face. And certainly my recommendation anyway would be that if you've tried for 2 years and it's still at this point, I think certainly a referral to a skin specialist and consideration of that specialist medication, Roaccutane, is certainly worth considering.
Yeah.
Unless you have some objections to that, unless you know.
That's fine,
Yeah. Okay. When the dermatologist sees you, he will go through some of the risks and benefits of this medication, the Roaccutane, because it's not entirely straightforward. There are some side effects that he'll probably go through with you.
Uncle's partner had acne and she had Roaccutane and stuff like that.
So you kind of...
She was saying that it burns and stuff like that.
Yeah.
But it made a hell of a difference.
Isotretinoin does require a lot of monitoring. It has been shown in some cases that the medication can have an effect on your mood and behaviour, and there have been some reports of people perhaps having thoughts of self-harm or even suicide with this medication. And so therefore it's usually initiated by a skin specialist or dermatologist. OK, so what I'll do a referral, and we'll give you some Epiduo and more of the tablets today. There you go. OK. You'll hear from dermatology in the post with the appointment details.
Lovely.
All right.
Cheers.
Take care.
Darling, you sit right back and right up, and you've got to make yourself really comfortable.
Okay, so the first bit, nothing fancy. I'm just going to draw on your head. Okay, so just going to do a sharp scratch now, okay? I'm going to put a little drape over you as well.
Okay.
Just thinking, can we move that? Probably there, that's good. I'm just going to check, can you feel any of this? No?
I'm not feeling nothing, no.
It's really tense, isn't it, the scalp? We'll put a vessel early. Got a very nice vascular scalp.
Oh, have I?
Yes. So it's oozing away nicely.
Good, good.
So we've got the cyst out.
Okay.
And it's come out whole, which is good.
Perfect.
I'm sorry if I grab a few hairs doing this.
No, no. Leave me some, please. Sir.
I thought I might just try and even the scalp out for you, that's all. I'm just going to take this off and I'll just give it a bit of a cleaning. This is the hairdressing bit now. So again, you won't thank me when you have to take this off, but it's good for now. So 2 days, yeah, of keeping this dressing that we're putting on.
Okay.
It did bleed a little bit, so if it starts oozing through today,
Yeah.
if it's going to happen, it's going to happen during the daytime today.
Okay.
And I want you to just walk in at the front desk and point at your head to the receptionist, and they'll find something. It doesn't happen that often, but if it does start oozing through the dressing, then I want you to come back.
Okay, perfect.
Okay, Mum,
All right.
just sit forward, we've got some red streaks.
Highlights.
And the dressing, that remains on?
So sorry, yeah. So after 2 days, you could take all the dressings off,
Okay.
and you can leave it open and exposed to air.
Okay.
So that's the 2 days of completely dry and dressing on.
Yeah.
2 days time, take the dressing off, and then you can have a shower.
Okay.
Cool.
Yeah, no problem.
Right, good stuff. And the stitches out 10 days. Just let them know downstairs.
Yeah, okay.
And that's it. That's your lot.
Thanks for your time.
Thank you.
very much.
Cheers. Bye-bye.
Bye.
See ya.
Her emergency doctor said she's picked me in.
And with the emergency doctor?
Yeah.
What's your name?
Alison Sloney.
Take a seat next door, please.
Hi, I'm Dr Tailor.
Oh,
I've worked with you.
my son.
Okay. How can I help?
My back's pain, absolute shit. So it's really bad. I can't rest. I haven't slept for 2 nights now. I've took sleeping drugs, but I still can't sleep.
How long have you been suffering with back pain for?
About 20 years.
So this is an ongoing thing?
Yeah.
Okay. And I can see you've seen the specialist as well?
Yeah, he said he can't do nothing for me.
Okay. Have you had physiotherapy and things for it as well?
Yeah, they said they can't do nothing.
Okay.
So I'm in limbo, you know.
How can I help you today?
Yesterday I had pains in my stomach, my lower back all day.
Just the last while I've been feeling a bit sick.
Those tablets are making me feel sick and horrible.
She has a bad cough, doctor. Day before night, she vomited.
And otherwise, has she been off her food at all?
Nothing
like that.
He was sick Monday night. He did start to have that sort of migraine-y, strainy look.
Just feel constantly sick all the time.
We go through quite a lot of these little sick bucket things. Surprisingly. Was someone sick today?
Yes.
Hello, Samantha. Come on in and have a seat. I'm Dr Bolger. We've met before, I think, haven't we? How can I help today?
Basically, I'm just struggling really with keeping the pain and the sickness under control. I've been vomiting since Wednesday, but I can't keep anything down now. My anti-sickness isn't doing anything now. I'm building that up.
What are you taking for anti-sickness?
Cyclizine 3 times a day. This morning I took my first painkillers about 5:15.
And which painkillers are we talking about?
Cocodamol, tramadol. I took morphine a couple of hours later, brought that up as well.
So you're taking tramadol, morphine, cocodamol?
Yeah. It's for the chronic pain condition. That's escalating now because I can't keep the...
And what's the plan with the chronic pain condition?
I'm waiting to see Hammersmith Hospital again. They're looking at my pancreas and the secretion. They can't seem to find out what is going on yet.
Right, OK. So let's check you over.
Thank you.
Feverish with it?
Cold,
yeah, hot and
I've had
cold.
diarrhoea and it's sort of hard to know if I've got bug because I have these symptoms so often.
It does come very often now, doesn't
Yeah,
it? Are you ever pain-free?
No, it's always there.
And they can't come up with any diagnosis for
No,
you?
they took my gallbladder out last year thinking that would
I
help,
remember,
but it made it
yeah.
a bit worse.
OK, right, let's get you across. Let's check you over, yeah? So really, if we could stop you vomiting, you could
Yeah.
keep your painkillers down,
Yeah.
or you could keep your fluids, couldn't you?
That's it, it's a bit
So
of a cycle.
cyclizine,
Yeah.
which is a good anti-sickness pill. Have you been on any others?
They tried me on Dansetron, but that they worried we didn't track for my citalopram, and they tried me also on metoclopramide.
Show me where the pain is. Lift
Okay.
up for me. You're okay for me to examine you,
Yeah,
aren't you?
that's fine. So at
Right.
the moment it's here and it's going round to there.
And that's where it always is.
Yeah,
isn't
it keeps going shooting up to my shoulder. That's the worst bit.
Okay, that's fine. Come back
Thank you.
across. I'm trying to think of something we can try for the sickness that hasn't been tried. Let me just go through your notes. Because the other option is you going up to A&E.
Yeah, I just try and avoid. Only
I know, I
because
can understand that.
I'm in for a few days normally. I'm normally in every month, but I've avoided it for the last few weeks. But I feel like I'm sort of.
On the edge?
Yeah, and I feel like I'm just being stubborn now. So I think I probably do have to go back in, but. I think I'm just in panic mode at the moment. What's left to try about going back? But I think I might have to.
You've had the domperidone, they've tried it before. We could
Yeah.
try it short term. They're right, it's not a long term solution, but just to see if we could try and get you to keep some fluids down.
Yeah.
The other alternative is A&E. Should we
Okay.
try some domperidone at least during the course of today?
I'm happy to take some time.
I think if this doesn't work, then you need to either call us again or go up to A&E as you normally do.
Thank you.
It's no problem.
Where in the back is the pain?
It's just there.
Across the lower back. Yeah. Does it move anywhere, or does it stay in the back?
It goes in my legs.
So it goes in your legs.
And my fingers.
Okay. And have you got normal control over your bowels and your bladder? Not having any accidents?
No, but it's like my bum's numb.
Okay. And has anything happened recently? Any injury or any trauma? Fine. What I'd like to do today is examine you.
Can you wait outside a minute, please?
Mm.
Thank you, Jonathan.
Okay.
Yeah. Sorry about this.
Not at all. You don't have to be sorry. I'm sorry that you're in so much pain.
I don't normally come as well.
What we're going to ask you to do is just to lie on the couch for me. Just a sec. I'm going to tap on the legs, and I want you to say yes when you feel me tap, okay?
Sorry. Oh, God.
You okay for me to continue?
Yeah. It's really bad.
Do you want to sit up for a second?
Yeah.
Yeah. I'll give you a hand. Just take a second.
Oh, I feel dizzy.
I'll get a lady to come in. Got my colleague Hannah with me, okay? So I'm going to be examining the back bottom, okay? So what I'm going to ask Hannah to do is just to kind of be with us when I examine you, all right? So I'm going to wind the curtain round. And if you just lower your bottom things, yep, okay. Okay, so all I need you to do is say, number one, whether you feel it, And then number 2, I'm going to ask you to squeeze down on my finger. Okay? Okay. Can you feel that there?
Yes.
Now, what I'd like you to do is now try and just squeeze down on my finger.
That's it. I can't do it.
And just try one more time. That's fine. Okay. Thanks. Alrighty. So, the reason I examined you is wanted to just make sure that there's no other sort of concerning signs that your nerves are being involved in your back pain, okay, which I don't think they are. It's not really a painkiller that you need, but actually something to release some of the tension in the muscles, because I think it's the spasm that's causing most of this pain at the moment.
Okay, what do I do then?
So there's something called diazepam, which you've probably had before. Yeah, and I would like to maybe try a short course of that, maybe 5 days worth, to take it 3 times a day, and that might just help ease the spasm. Now, obviously, in that time, if the pain gets worse, if you start losing control of your bladder, your bowel, or the numbness gets worse, then you come back and let us know. Okay? Let's try that and see how you get on.
All right,
okay.
then.
All right.
Cheers.
You're welcome.
Thank you.
Okay, take care. Bye-bye.
Jonathan.
One morning last week, we were walking across the by the scout hut, and some bloke's gone past with a dog, or down that sort of alleyway. Short sleeve t-shirt and shorts. I thought, bloody freak. I had a jacket on, a scarf on, gloves on, and he's got a short sleeves t-shirt and shorts.
So a bloke walks past the house in the morning with the dog, and he's got his shorts on. I figured, oh, that time of the morning, not awake then.
Okay, so let's have a look. So you had some bleeding, did you?
Yeah.
That's settled now?
I haven't done anything since, gosh.
Okay. So you're quite keen to start HRT, okay.
I don't know what it is.
Okay,
I've heard about
it's hormone replacement therapy, so it's basically replacing the hormones that you previously had.
Yeah.
And when did you go through the menopause?
Oh, God, well, I didn't know I was. I'd say from when I had Riley.
Okay, 42. Okay. So you're using any form of contraception at the moment? Okay.
I ain't done anything.
Okay.
Got no sex drive, nothing.
Okay. And how are you feeling otherwise?
I'm a bit of a mad, a bit moody and, you know.
So the estrogen will help with that, okay? So there's 2 main female hormones, and one's called estrogen, one's called progesterone, and they do different things, okay? But we'd have to replace both of them. It has lots of positive effects, okay?
Right,
so, you know, and it has, you know, helps protect against osteoporosis and things like that. But unfortunately, estrogen has also a few not so great things, and that's why I don't know if you know about all the bad press that went along with HRT and things, that the risks of sort of developing blood clots.
But obviously you keep an eye on things like that.
Completely. So we would expect you to come in every 6 months, have a blood pressure check, talk through how you're feeling. But it's for you to be aware of, because actually they're quite, although the risks are very, very low.
Quite serious things.
Completely. Okay, so there's lots of good things and lots of bad things.
Scaring the life out of me now. Go on.
No, I just need to tell you, it's about trialling it, okay, and obviously doing all that you can to keep your risks down. I'm naming big names, but the risks are very small, but obviously the cancers of the womb and the ovary as well, but that's where the progesterone comes in, okay, because estrogen will build up the lining of your womb again, okay, which is a risk factor for developing cancer of the womb. So, so what the progesterone do will just shed it away, so you'll have a bleed every month like you used to.
Oh, really?
Yeah, completely.
Great. I don't get any now.
Okay, so it's just 1 tablet every day. I want you to come back and see us before you run out. If you develop any pain in the leg, in the chest, stop taking them straight away, see a doctor. Okay, have a read of the leaflet.
Will it be severe pain? I know it's not right pain, won't I?
Yeah. It won't be something little, okay. But if you've got any concerns, please do come and discuss it with one of us.
If I just think something's not right, just not take the next one and then make an appointment.
Well, you can actually just speak to a doctor over the phone and say, look, I've just started taking it. Can you just check? All right, so don't worry.
Yeah, thank you very much.
Bye-bye.
Cheers, bye.
Oh, I'm having stir fry for dinner.
Woohoo! What are you having for dinner?
Stir fry. I haven't had stir fry in ages.
Are you making it?
I'm technically making it,
because I'll be putting my noodles with my stir fry and then like put it all together.
That's a stir fry.
I'm putting it on my plate. Yeah. Kind of making it, I guess.
You're stirring it in a pan?
I'm stirring it and frying it.
Hello.
Hello.
Right, which one's John?
Me.
All right, have a seat, John. I'm Julie, how can I help?
Every time I breathe in, I get a pain in my chest.
All right, OK. How long's that been going on for?
Since yesterday. You can hear it.
Oh, I can hear the wheeze, yeah. And it's normally asthma, Mum, or?
Yeah, he's got a little bit of a tight chest.
Yeah, so has he used inhalers before?
No.
No. OK. All right, we're just going to...
When he was younger, yeah.
When he was younger?
Yeah, he was quite asthmatic, like...
Oh, he did have asthma when he was younger?
Younger, yeah.
Right, just stand up for me. That's it. Just breathe in and out through your mouth. You're quite wheezy there, aren't you? Just have a seat, John. Let's pop your finger.
Jimmy.
That's a good lad. Okay. So what I'd like to do is give him the nebulizer, okay, and then I'll check him again.
Is it very serious?
No, darling, it's just your asthma that's just come back, that's all. I'll give you the medicine through the mask.
Morning, Timothy. Hi.
Morning.
Come through, come and grab a seat. Thank you for waiting. Sorry about the delay, Timothy. How can I help today?
Right, I need a full range cholesterol test.
Yep.
And I've got a broken rib, at least one broken rib.
Okay, all right. In terms of medication, what medication are you taking at the moment, Timothy?
At the moment, just amulosine, but I'm going to start taking my heart medication again.
Have you ever had a heart attack before?
Yes, I've had two.
Okay. And in terms of the heart medication, why did you stop the heart medication?
I was having too many side effects and...
Okay. The medication that you're given is very good medication. Has actually been shown to be protective after people have had heart attacks.
Yeah.
Okay. So patients who've had heart attacks, they should be on these medications.
Well, yeah.
Yeah. And Timothy, the other question I have for you is, in terms of alcohol, how much alcohol are you drinking at the moment?
Probably about 2 pints a day.
Okay. And have you tried to cut down?
I don't need to. I have a thiamine deficiency and I drink Guinness, which prescribed by a consultant 20 years ago.
Thiamine is a B vitamin, and its deficiency can result in multiple signs and symptoms, and it can affect the cardiovascular, neurological, and gastrointestinal tracts. Some of the signs and symptoms include nausea, vomiting, and fatigue.
I became deficient in thiamine, and I ended up being seriously ill for 9 months, and I ended up in hospital. And a friend took me out for a drink. I had 2 pints of Guinness, and I was cured.
Most people associate Guinness with high iron content. Guinness or any other alcohol is not a recommended treatment for thiamine or iron deficiency. We can treat both of these with effective nutrition, and also if it's severe, we can give medication.
There's well-documented evidence about what safe levels of drinking are.
That's right.
And safe level of drinking for men, now the current guidance is 14 units per week.
Yeah, well, I drink 1 can of Guinness in the morning and 1 at night.
Okay, so 14 units per week, and you should have at least 2 alcohol-free days in a week. That's the safe
No,
limit.
if I had 2 alcohol-free days, I wouldn't be able to work.
Listen to your tummy. Do you want to put it on for me? I can hear your lunch. What did you have for lunch?
Peanut butter sandwich.
Peanut butter sandwich. I had peanut butter sandwich as well.
You've got 2 girlfriends? Oh, that's a lot.
I'll have some more.
Oh, what's your son up to?
How is your vacations going?
Well done.
Where are you off to, mister?
Thank you.
You're very welcome. All right.
Nice day.
I hope you feel better.
So all it is, it's just the medicine, but it's just going through the mask, and it'll be like steam that comes out. Okay, so like steam in your face. You just have to breathe normally. That's it, good boy. Oh, it helps if I plug you in. Right, can you jump up off there for me, and I'll just start writing up his notes. That's it, good lad.
Hopefully you don't get worse.
So can you remember when he last used inhalers, Mum?
It's usually during the summer.
Just sometimes in the summer with hay fever, he might have some problems. And then does he use the blue inhaler? Don't press on anything, as it might all disappear.
Feel better, Jimmy? In your chest?
Are you feeling any easier?
Yeah, it's feeling a lot easier, but I can still feel that little bit.
Just...
Oh, no. Thomas is looking straight at you.
I have to.
You're very curious, aren't you?
Kevin.
Right. Wow.
I'm gonna go back in. It's just I'm asking these two to stop playing up a bit.
Wait till that stops steaming. Just keep shaking it slightly just to get rid of those last few drops. Don't feel any better when you're breathing in?
Yeah.
Yeah?
I can breathe deeper now.
Good, good. So what I'll do, Mum, I'll give him some inhalers, and I just want to check his chest again. It's in your purse.
Kevin, well, talk to the nurse. Yeah, in a minute, Kevin.
Unless I have Guinness, I can't work.
Do you ever feel shaky in the morning?
No.
Do you ever crave the alcohol?
No. I don't even like the taste of Guinness.
My job is to make sure that you live until you're 150, all right? That's my job.
And you just have to take it from me that if a consultant recommends that I have 2 pints of Guinness a day,
Yeah.
and I know that to be a fact.
Timothy,
Time and again.
I can assure you, as your GP today,
Yeah.
that it is not good for your health, okay?
It's important in our role as general practitioners that when we encounter patients who don't want to change their ways, that we don't get frustrated. And our job is to offer the correct evidence-based advice to hopefully allow the patient to one day change their ways and adhere to the correct treatment plan.
I know my body, so there's no point you trying to tell me that it's not.
Sure.
Your opinion on Guinness is totally different from my experience.
Sure.
I don't drink excess alcohol.
Okay. Now, Timothy, in terms of the broken ribs, tell me what happened.
I fell off a motorbike in Kenya
When was that?
about a month ago.
Soreness on the right side of the chest. have you?
Yeah.
What I want you to do is stand up for me. The pain, is that tender there?
Yeah, just a little bit.
Okay.
Yeah.
Turn around.
Broken rib is in
Turn
that
around.
area.
Okay. Take some big breaths in and out. And out. And again. And out. In terms of the chest,
I need an X-ray.
for a broken rib or for a query broken rib, we do not X-ray unless there's certain indications. That makes sense. Your chest is clear. There's no evidence that you have an infection in the chest, which is good. You've got good air entry on both sides.
Yeah.
Your oxygen levels are perfect, so you do not need an X-ray.
Right, so you're confident that the rib is healing up?
Even if it was broken,
Yeah.
we don't X-ray because the treatment, whether it's broken or not broken, doesn't change. It's pain relief, and it will heal.
No, that's not strictly true, because if the rib is not healing correctly...
Yeah, because at the moment there's no indication for us to get the X-ray.
Right.
Keep going with the pain relief, and this should settle down, okay?
Yeah.
If it's not settled down in the next 3 to 4 weeks' time, you come back in and see us.
3 to 6 weeks, a rib's supposed to heal.
So, Timothy, in terms of moving forward now, okay, take the pain relief and let's see how we go. All right then, baby.
Thanks a lot.
No trouble.
So I think we'll treat him full on as asthmatic with the steroid inhaler, and just to get on top of things.
Jimmy's not feeling well, Kevin, so you've got to just have patience.
Right, lovely. I think that's done now, isn't it? That's it. Good lad. So I just need to have a look at your brother again now. Okay, so you stand over there with Mum.
Good boy, Luke. Stand
That's
here.
it. Let's have you on the scales then. That's it. Okay, 48.
Stone.
No, that's kilograms. Okay, you jump up because I need to be here. That's it, thank you.
Kilograms.
Right, let me just check your chest again and then we'll get your medication.
It's a lot less squeaky than it was before.
Yeah. There's still a little bit of a squeak there, but it's a lot better. Sounds a lot better.
Luke, Kevin, why are you doing this, Kevin?
So he'll definitely need some steroids. Okay, jump up.
Don't steroids make you get muscly.
They might do, eh? So I'll give you a brown inhaler. Okay, so take 2 puffs in the morning, 2 puffs in the evening.
Okay.
And a blue inhaler. Okay, so the blue inhaler you take, whilst your chest is bad, take it every 4 hours.
So the brown one, 2 in the morning
And 2 in the evening, right.
Are we going in now?
What do you say, boys?
Twice in the morning, twice in the evening.
What do you say, boys?
Well done.
And
You take it to nurse, okay? Thank you ever so much, nurse. I appreciate that. Lot.
All right then, take care. Okay.
Bye-bye. Say bye-bye, boys.
Stickers. There you go.
Thank you.
All right
Thanks
then,
ever so
bye-bye.
much. Bye-bye.
We'll see you next time. All right. Bye-bye.
Excellent.
Thank you very much.
No trouble. Love to see you. Bye-bye.
Sorry, you're not a pain at all. I'll see you in a couple of weeks. Yeah?
Thank you very much.
Bye-bye. Bye-bye.